Hello, my name is AJ Reeves, and I am a senior at Mallard High School, and this is my project on treating and or possibly medicating adolescents with mental health disorders. You may be asking yourself why I decided to discuss the adolescents demographic of mental health. Mental health affects people all around. Well, for many reasons. One being that today we live in a society where there's been so many status quos put on everything that nobody knows what to do. People are very heavily influenced. Also, because since the adolescent's mind is still in a state of development and it's vulnerable to developing some of these disorders. Thirdly, because ultimately the decision of medicating and treating a child with mental health issues is up to that parent or up to circumstances that that parent may have placed or may be in, such as a parent disagrees with treatment, putting that child at a disservice, or it may also be a lack of insurance or thereof insurance, but it's not enough to cover this medication. Some insurances don't even really deal with mental health as, underneath their umbrella of things that they cover. Now, there are sometimes situations that a parent cannot help, such as, circumstances like I was saying. They can be put in a financial circumstance where their insurance is not covering enough for them to even be able to afford it, or thereof a lack of insurance where they can't afford medication, treatment, or anything at all. Now, situations like this where it's a financial issue are understandable, where your insurance isn't covering enough. That's understandable. A scenario where you cannot medicate your child. You don't have the funding for it, or or whatever situation may be affecting you. Even though it's recommended that you still try and seek out some help to cover these expenses to medicate your child and treat your child, because your child is being put to a disservice that they cannot really necessarily help. Now, as for parents that refuse to medicate, treat, or in some cases even refuse to get a diagnosis or be seen for anybody, that's a disservice that can't really be excused. But it's not really their fault. It really comes down to ignorance. Not ignorance in a sense where you're ignorant because you don't want to know, you're just ignorant because you do not know. For example, parents sometimes see medication in a negative sense because these medications are required to put their side effects when the incidence of the side effect may not even be that high. However, to a parent who is refusing to treat or medicate their child, I do ask you this. What would you say to a parent of a child of cancer refusing to treat their child or medicate their child? I'm sure you would call that borderline neglect, as we all would, being the rational person that you are. But that's still the same sense, because they're both chronic diseases that debilitate the patient in a significant way. Also, when some parents hear the phrase treatment and or medication, they only hear the word medication. And they see medication in a negative sense because of the side effects they've heard associated with medication. But medication shouldn't even be the first step to treating a child with a mental illness that's debilitating them in a significant way. The first thing that you should do is seek out treatment. And treatment isn't necessarily medicate your child. Treatment may be, for example, ADHD kids can often benefit from time management and organizational skill development and learning all these skills and assets to help them deal with their disorder. Final reason why I looked at the adolescents demographic of this issue is because of the rising statistic in America today throughout this population. Today in America, 1 in 5 youth will or at some point in their childhood suffer from a mental disorder. That is in a normal classroom setting of about, let's say 30 students. Six of those students will be suffering from a mental disorder. And it's also reported that 20% of those suffering from a mental disorder receive no type of treatment at all. meaning one of those students will be receiving no treatment. Also meaning that these 20% of students, or this one student, is left to figure this mental illness out on his or her own. Well, you may be thinking to yourself, how do I know this data is even right? The National Comorbidity Study is a nationally recognized data on mental illness. They reported that 1 in every 4 to 5 youth suffer from mental illness, meaning that 75% to 80% of students suffer from a mental illness. Also meaning 20 to 25% do not. I also conducted a survey where I asked 193 students if they suffered from mental illness. 67.4% said that they did not suffer from mental illness. 32.6% said they did. Now, you could be saying that, well, I'm looking at these graphs and they don't even match up. If you take into account that my survey was solely conducted in North Carolina and maybe just a few states outside of it. The National Comorbidity Study was a study analyzed throughout the country. Also, the National Comorbidity Study asked 10,000 people. I only surveyed 193. And lastly, I had a third category. Our third category comprised of those who felt they did suffer from a mental illness but did not receive any diagnosis. That group made up 15.5% of the 32.6%, where those who actually had a diagnosis made up 17.1% of the 32.6%. Also, my next question to those who were diagnosed with mental illness, if they were receiving treatment in conjunction with their mental illness, 21.2% responded that they were not. And again, it is nationally reported that 20% of those affected by mental illness is receiving no treatment at all. So this data is not so far off. So today I'm going to ask you a series of questions, answer them to the best of your ability. I did my senior exit project on medicating youth with mental health disorders. All right. Mental illness affects how many American children today? Is it 15 to 20%, 7 to 13%, or 20 to 25%, or 30 to 45%?
30 to 45%. Like about 15 to 20%.
National Comorbidity Study reports that 1 in every 4 to 5 American youth suffer from some type of mental disorder. Ma'am, is this statement true or false? Medication is the best approach towards mental illness and should be used as soon as a diagnosis is made.
True. False?
Treatment is often effective, like in ADHD patients, it's often effective to teach them time management skills as well as organizational skills. This statement true or false? Pneumonia became the third leading cause of death among people ages 10 to 25 as of 2014.
True. True.
Suicide is the third leading cause of death, and pneumonia was number 7 according to the CDC by a statement made in 2004. Suicide still remains to be the third leading cause.